Hello students, you are welcome to Angel Health Academy. Subject Community Health Nursing. Topic for the session or topic for the day is Community Mental Health Nursing. So the content of this particular subject can be used in both community health nursing and even in mental health nursing or psychiatric nursing. So in this video I would like to talk about community mental health nursing. The content of the video includes introduction, definition, aims or goals of community mental health nursing, objectives, importance of community mental health nursing, scope of community mental health nursing, models of preventive psychiatry, that is application of levels of prevention in community mental health nursing. Then facilities for the community mentally ill people in the community, facilities in community. Then various issues or problems in community mental health nursing. Then community mental health programs and role and functions of a community health nurse or mental health nurse in community mental health nursing. First is about the introduction of the topic. The community mental health movement in India was started in 1960s. So from 1960s in India, Government of India started a certain community mental health movement or activities or services. Later in 1963, Government of India introduced the Community Mental Health Centers Act. So Community Mental Health Centers Act was passed in 1963. Then followed by in 1970s, community clinics were started or introduced in primary health centers, and even training for both medical officers and even for multi-purpose health workers, ANMs, etc. also were started in India from 1970s. Based on these developments and depend upon the various historical developments in community mental health nursing, the method of treating mental illness or mental patients have changed dramatically in the past century. Moreover, the community mental health services or community mental health nursing in India was outlined by our former Prime Minister Srimati Indira Gandhi in May 1981 while she was addressing at World Health Assembly. She said that in India, we would like to go homes instead of large numbers gravitating towards centralized hospitals, because services must be given where people are, where problems arise, and to provide mental health care through multidisciplinary approach and collaborative services. So during the World Health Assembly in 1981, former Prime Minister Srimati Indira Gandhi said that our community mental health services is outlined as we make home visiting and we find the people, those who are suffering from any mental diseases or mentally ill, and we treat the people at the community itself with the available facilities, community facilities, because we follow the motto of services must begin where people are, where problem arise. Usually people are available in the community and the problem of mental illness and mental diseases are begins at community or at home. Thus, we do the home visiting and we do the early detection of the mentally ill cases as a part of community mental health services or community mental health nursing services. Then we provide the care to the mentally ill people through multidisciplinary approach. That means we use indigenous system of medicine such as Ayush and other traditional practice of medicine to treat the mental illness or mental diseases, and at the same time we do the collaborative services, that is team approach and cooperation between the various health sectors and various health agencies. Thus the community mental health services or mental health nursing in India is outlined by Srimati Indira Gandhi in May 1981 with home visiting and utilization of community facilities to early detection of the cases and treatment and management of the mentally ill and mentally diseases people through multidisciplinary approach and collaborative services. Next is the definition of community mental health nursing. According to Bimla Kapoor, she was written in her textbook, that is community mental health nursing is the application of knowledge of psychiatric nursing. So it is the application of knowledge of psychiatric nursing in promoting and maintaining the mental health of the people, in the promotion and maintenance of the mental health of the people, and to help in early detection or early diagnosis and care to the mentally ill people, and even to rehabilitate the client or the patients after mental illness. So according to Bimla Kapoor, community mental health nursing is the application of knowledge of psychiatric nursing in promoting and maintaining the mental health of the people in the community. Thus to help the people in early diagnosis and early detection of the mental illness and followed by care, provide treatment, care and to rehabilitate the clients or community patients or psychiatric patients after their mental illness in the community setting is called as community mental health nursing. So community mental health nursing is the application of knowledge of psychiatric nursing in promoting and maintaining mental health of the people to help in early diagnosis and care and to rehabilitate the clients after mental illness. This is the definition given by Bimla Kapoor. Next is the aims, goals or purposes of community mental health nursing. Aims, goals and or purposes of community mental health nursing. There are 5 important aims or goals or purposes of community mental health nursing. They are, first one is provide preventive activities or preventive services. So provide prevention activities or preventive services to the people or to the community to promote the mental health. So provide preventive activities or prevention services or preventive services to promote the mental health of the people of the community. Second aim or goal is anticipate emotional problems among the community people. So early detection of the various emotional or behavioral problems among the community people and provide the corrective learning. So anticipate the or early detection of the emotional problems or behavioral problems among the community people and provide a corrective learning or correct such behavioral problems or emotional problems. Then third aim or goal or purpose is provide prompt intervention based on the problems of the community people with available community facilities. So provide prompt interventions or treatment services to the mentally ill people in the community based on the facilities available in the community. Then fourth aim is develop innovative approach in levels of prevention. So application of levels of prevention in mental health nursing to prevent the mental ill problem among the people in the community. So develop various new and innovative measures or approaches in levels of prevention, that is in primary, secondary and tertiary prevention, and especially in primary prevention to prevent the mental illness and mental problems among the community people. The last aim is, that is the fifth aim or goal or purpose of community mental health nursing is provide mental health education to the people in the community. So provide IEC, information, education and communication program in relation to mental illness and mental health to the community people to promote the health to prevent the psychiatric problems of the people in the community. So provide mental health education to the people of the community, that is for to increase the awareness of the community people in relation to the mental diseases or mental illness and make them to utilize the available resources with the increased awareness of the available facilities and resources and services in the community setting. So these are the 5 aims or goals or purposes of community mental health nursing. Next is objectives of community mental health nursing. Next is objectives of community mental health nursing. First one is promotion and maintenance of the mental health among the people in the community. Promotion and maintenance. One is promotion of the mental health of the people, because mental health is the important part of the general health. So promotion of mental health and maintenance of the same mental health without any decline in the mental health. So promotion and maintenance of the mental health of the people in the community. Second one is prevention of mental illness and prevention of stigma or reduction of stigma. That is, stigma is the misconception about the mental illness and related problems by the community or in the society. So prevention of mental illnesses and stigma from the community. Then third one is promote community participation in relation to rendering various mental health services to the people. So promote community participation to improve the community mental health services. And fourth one is early detection and treatment of various community mental health problems, both mental and neurological problems and their associated disabilities, etc. So early detection of the neurological and mental related problems and associated disabilities and make prompt treatment, that is early detection and treatment. Then fifth objective is provide basic community mental health facilities for the community people, that is provide basic community mental health facilities for all the needy people in the community with the various problems. So provide basic community mental health facilities to all the needy people in the community. Last one is encourage IEC, information, education, communication, that is awareness program in relation to mental health nursing to the community people. So encourage awareness activities, health education programs in the community settings to increase the knowledge or awareness among the people for the early detection and maximum utilization of the available resources and available services in relation to community mental health nursing. And last one is encourage in IEC, that is information, education, communication in mental health nursing. So awareness programs, conduct various awareness programs in relation to mental health nursing for the promotion of mental health nursing and prevention of mental illness in the community people and in the community setting. So these are the 6 important objectives of community mental health nursing. The next session related to importance of community mental health nursing. What are the importance of having community mental health nursing or providing community mental health nursing? First one is to promote and maintain the mental health of the family. So here community health nursing means we refer not a single individual, the total people in the family. So we give importance to the family. So promotion and maintenance of the mental health of the family through various preventive and promotive interventions and services in the community. That is the first importance of community mental health nursing program, that is, or services, that is to promote and maintain the mental health of the family through preventive and promotive services or interventions. Second one is to enhance the potentials of community people, strength of the community people. So motivate the community people to use their strength to provide essential competency for positive mental health. So to enhance the potentials of community people to use their strength to provide the various essential competency services for positive or promotion of the positive mental health among the people. And third importance of community mental health nursing is to educate all the family members regarding the identification of various stressors and various coping mechanisms to deal with the mental health problems. So educate all the family members in the community regarding the early detection or identification of the various stresses present in the family or members of the family and different coping mechanism, defense mechanism they are having to deal with the mental health related problems. The fourth importance of community mental health nursing is to help family members to recognize that the social, cultural and situational aspects have an influence on behavior of the different people and how it can affect the individual person's behavior in the family. So make the family members to understand that, recognize that there are many social, cultural and situational factors or aspects which influence their behavior and that influence can indirectly affect the interactions and communication in the or behavior of the family members. So help the family members to recognizing such social, cultural and situational aspects and factors which influence which affect the normal behavior of the people in the family or people in the community. So the last importance of having community mental health nursing is to teach the community people, all the community people, to monitor, to identify their mental health and that of the community. So to identify both the community people mental health and the total community mental health. So teach the community people to monitor, regular monitoring of detection of their mental health, promotion of mental health and that of the promotion of community mental health. So these are the 5 importance of community mental health nursing. Next is scope of community mental health nursing. Scope of community mental health nursing. Scope means what are the different community mental health care services available in the community for the mentally ill people or people with different mental disorders. Let us see what are the important scope of community mental health nursing. First one is mental health promotion services or preventive services. So community mental health care includes as a scope, first is mental health promotion services for the mental health promotion of the people in the community with various preventive services. Second is stigma or misconception prevention or removal from the community. So the activities which are related to remove the stigma from the society or from the community people and to correct the misconception of the people in relation to psychiatric diseases or mentally ill problems. Then third scope is psychosocial support to the patient and in his family in the community setting, psychosocial support of the family, those who are having mentally ill and mentally diseased people in the family, and rendering counseling services. So that is psychosocial support and counseling. Fourth scope of community mental health nursing is provision of various rehabilitation services for the community mentally ill people. That is provision of or providing rehabilitation or rehabilitative services to the mentally ill people or patient with the mental disorders in the community settings. And fifth scope is prevention of harm from alcohol and other substance uses or from substance abuse. So prevention of harm from alcohol and other different substance abuse. Then sixth scope is treatment for mentally ill people in the community. Prompt treatment for the mentally ill people in the community by using the available primary health care system or primary health center and community health center services to treat the community mentally ill people or people with various mental disorders in the community. Then there are many other services also available as a part of community mental health services. That is mental health education programs and other IEC programs, etc. So these are the important scope of community mental health nursing. Next is the models of preventive psychiatry. So when we talk about preventive psychiatry, that is nothing but application of levels of prevention in community mental health nursing. Application of various levels of prevention in community mental health nursing. So it includes primordial prevention, primary prevention, secondary prevention and tertiary prevention in relation to community mental health nursing. Primordial prevention include behavioral modification of the youngsters or children and making sound habit formation in the early age to prevent the risk of having mentally ill or mentally diseases in the future. That is behavioral modification and sound habit formation among the children and youngsters, thus to prevent the future problem, chronic illness of mental ill or mental diseases. Then followed by next is primary prevention. That is action taken prior to the onset of the mental illness. So that includes the promotion and maintenance of the mental health of the people in the community and the various specific protection activities or measures or services to prevent the occurrence of the mental ill in the community people. Then next one is secondary prevention. So once primary prevention is failed, people may suffer from different mental illness. So early detection, that is early diagnosis and prompt treatment based on the facilities available in the community, that comes under secondary prevention. Then last one is tertiary prevention. It includes disability limitation, counseling and rehabilitation services in the community setting for the mentally ill and people with different mental diseases in the community. Thus, levels of prevention includes primordial prevention, primary prevention, secondary prevention and tertiary prevention. Let us discuss in detail about these four levels of prevention. That is application of levels of prevention in community mental health nursing. First is primordial preventions. As I have already mentioned, primordial prevention focus on enhancing the healthy environment in the community for the youngsters. Enhancing or providing healthy environment. That is, as I said, behavioral modifications, sound habit formation, etc. among the youngsters. Thus to prevent the future chronic mental illness. So this is for the prevention of development of risk factors among the community people or in a different population group in the community. So this is for a prevention of development of risk factors in the future and that may lead to various mental illness or mental diseases among the community people or population group. The specific interventions comes under primordial preventions are special attention or preventive services for the youngsters, health education or health promotions activities, IEC activities or IEC services, then provision for community services availability to the mentally ill people, then school health program or school health services, and last one is elimination of causative agents and risk factors that specifically happen in a particular family. They have a history of mental illness or mental diseases in the family. So first intervention is giving special attention or preventive measures in the community, that is to prevent the future chronic mental diseases. Second one is health education. The main intervention under primordial prevention is health education, which includes discouraging the child from adopting the harmful lifestyles or habit formation and making the child to develop a sound habit through individual and mass education to the community, thus preventing the future risk of the mental illness in the community people. So health education is focusing to discouraging the child from adopting the harmful lifestyles and motivating the child to have sound habits, good habits through various individual and mass education, thus preventing the future risk for the chronic mental illness in the community. Then providing various community mental health services that is available in the community to cope with the stresses which usually the people will have in the community. So to prevent the stresses, there are various community mental health programs, services in the community. So providing community special services or available services to the people to solve or to cope with their stresses, thus preventing the future occurrence of the mental illness or mental diseases in the community. Then, as I said, school health program or services with the health awareness program to the school child, thus to modify the behavioral in early stages and thus preventing the future occurrence of the psychiatric problem among the children. Then elimination of various causative agents and risk factors such as stress, substance abuse, violence behavioral among the people or children, and the risk factors, special risk factors occurs in the specific family, etc. These are the 5 important specific interventions under primordial prevention. The next is the primary preventions. In this, actions are taken before the onset of the mental illness or mental diseases. It seeks to prevent the occurrence of mental illness by strengthening the individual and group's coping mechanism. The aim of primary prevention is strengthening the individual capacity or group capacity or increasing the coping mechanism, defense mechanism to solve the behavioral problems and stresses among the community people. Primary prevention includes the promotion and maintenance of the mental health of the people in the community and specific protection towards the risk people in the community, early detection of the risk group and giving specific measures, preventive measures, thus preventing the future occurrence of the mental illness or mental diseases. That is specific protections. So there are 3 specific interventions under primary prevention. First one is identification of people at risk. Second one is identification of various stressors, that is actual and potential stressors among the community people. Then development of various community-based programs, preventive programs, and providing awareness classes for the caregivers in the community settings. So first one is identification of the people at risk in the community. So there are some people who have family history of various mental illness in the community. Those people has to be identified. So early detection of the people with risk and modification of their risk behaviors. Then identification of the stresses among the community people, both actual and potential stresses, and motivating the coping mechanism or strengthening the coping mechanism of the people to solve the stresses and prevent the future occurrence of the chronic mental illness and diseases. Third one is development of community-based programs, community-based preventive programs through health promotion education, that is IEC, information education communication regarding mental illness and mental diseases. Then positive reinforcement, strengthening the people to solve their behavioral problems or modification of the behavioral problems. Then assertiveness training or active training risk families, risk peoples. Then making different self-help groups in the community, thus solving the and preventing the problems. And last one is providing awareness program, to awareness sessions for the caregivers in the community settings. So this all comes under specific intervention for the primary prevention of mental illness under community mental health nursing. The next levels of prevention is secondary prevention. So here the target peoples are those who show early signs and symptoms of the mental illness or mental health disruption, but at the end they regain the pre-morbid level of function through various prompt or aggressive treatment. So secondary prevention means early detection of the people and adequate and prompt treatment. So which includes all community actions or measures which reduce the progress of the mental diseases as its incipient stage, in the early stage. So reducing the or halting the progress of the various mental illnesses and diseases among the community people in its earlier stage, incipient stage, thus prevent the related complication and disability which occurs in the future. For that we have a secondary preventions. So early identification of the or early diagnosis of the various mental illness with the community actions and community measures and facilities, and rendering prompt treatment to the mentally ill or the people with the various mental diseases in the community. Thus we can reduce the complication and related associated disabilities in the early stage or incipient stage. That is about the secondary preventions. The specific interventions under secondary preventions are early diagnosis, continuous monitoring, crisis interventions, and prompt treatment. So there are 4 important specific interventions under secondary preventions in community mental health nursing. First one is early diagnosis. That is done through screening of the risk people and periodic examination of the population at risk and those who show the minor symptoms of the mental illness and mental diseases. So early diagnosis with the screening and periodic examination of the community people or population at risk in the community and those who shows the symptoms, early symptoms of the mental illness. Then followed by continuous monitoring. Next specific intervention is continuous monitoring of those people, that is the clients or cases, those who shows the symptoms of the mental illness and mental disorders in the community. Then third one is crisis interventions or emergency management of the mental illness through hotlines, walk-in clinics, walk-in hospitals, etc. with various other measures. Then prompt treatment, adequate treatment for the mental illness and mental diseases such as medical treatment, physical treatment, psychological interventions, counseling, psychotherapy, etc. both in hospitals and direct care services in the at home to manage the various mental illness and mental diseases. So there are mainly 4 interventions, specific interventions under secondary prevention, that is early diagnosis, continuous monitoring, crisis interventions or emergency management, and prompt treatment for the mental illness like medical management and pharmacological management and psychotherapy and even direct care management or services. The fourth one is tertiary prevention. The target people for tertiary preventions are those with mental illness, and this tertiary prevention helps to reduce the severity, discomfort and disability associated with their mental illness. So the aim of tertiary prevention is to reduce the severity of the mental illness or mental diseases, to reduce the discomfort of the mental illness or diseases and disability associated with various mental illness and diseases, which includes all community measures available to reduce or limit the impairments, disabilities, thus to promote the patient's adjustment to irremediable conditions, that is through rehabilitation. So this includes disability limitation and rehabilitation programs, that is all community measures available to reduce or limit the impairment, disability that occurs due to different mental illness and mental diseases, and to promote the patient's adjustment to irremediable condition means without treatment through rehabilitation programs. So there are various rehabilitation programs for the people with mental diseases in the community setting. Specific interventions of the tertiary prevention includes the main focus is disability limitation and second one is rehabilitation programs. There are many rehabilitatory activities in the community, which includes daycare centers, daycare services, hospital, psychiatric hospital or partial hospitals, foster homes, then self-help group in the community, a specific group of people with a specific mental ill problems, and various liaison workers, using the liaison workers to manage the problems. So this all comes under rehabilitatory activities or rehabilitation services to reduce the disability and bringing back to the normal health of the people in the community. That comes under tertiary preventions. So these are the 4 level application of levels of prevention in community mental health nursing. Next is community mental health facilities available for the mentally ill people or people with various mental disorders in the community. So community mental health facilities. There are many community mental health facilities available that varies from community to community. The most important ones are hospital services, partial hospital, quarter-way homes, half-way homes, self-help groups and others such as suicide prevention centers, etc. So there are mainly 6 different community mental health facilities I would like to talk in this video, that is hospital services, partial hospital, quarter-way homes, half-way homes, self-help groups and others. Let us discuss one by one community mental health facilities available in the community for the mentally ill people. First one is regarding hospitals. So hospitals are the part of continuous services, continuous mental health services for the prompt treatment for the mentally ill patient in the community settings. We have psychiatric hospital, specialty hospitals, and we at the same time general hospital with the psychiatric wards. For example of psychiatric hospital is Nimhans at Bangalore is the special hospital for the psychiatric patients. And we have most of the medical college, we have psychiatric wards to treat the mentally ill patients. So these all are the part of the community. Then hospitals, of course, it offer the variety of prompt treatment, accurate treatment facilities for the psychiatric patients or mentally ill people for 24 hours. That is round the clock they provide the services with the prompt treatment to the mental illness and mental diseases. The second one is partial hospitals. As the term indicates, this hospital will provide partial services only in the daytime, not in the night. So this is called partial hospitals. Thus, partial hospitals may provide innovative and alternative services to the mentally ill patients. Thus, it is ideally suitable for patients with chronic psychiatric symptoms, neurotic conditions, drug and alcohol abuse or dependence, then mentally retarded patients, etc. So for those, it will be suitable. They need only partial hospital services. So in the daytime, they'll get the services. They can avail the hospital services, and the evening they can go back and they can join with their family members. So for example, for the partial hospitals are daycare centers, then day hospitals, day treatment programs, etc. All comes under partial hospitals. They render the services only the daytime, and nighttime patient can go back to and join with this normal functioning with his family members. Another facility which is available in the community setting is quarterway homes. Quarterway homes they are usually located within the hospital campus only, but not having the regular hospital services in quarterway homes. There may not be routine nursing staffs or nursing personnel in this hospital, and there may not be routine regular rounds of the wards. Here most of the activities or services in the quarterway homes is rendered by or given by patient themselves only. So it may be the period of the rehabilitation program for the patients. So they can stay together in a home that is in the hospital campus only, hospital compound only. If any emergency comes, any crisis intervention needed, they will be get attention from the hospital management and hospital system. Otherwise, they taken care of themselves in the quarterway homes. So the next facility is halfway home or foster home. Here a group of discharged patients will stay as a transitory temporary that shelter in the nearby the hospitals, and they may given some sort of the services or support by the hospital authority. So it is a transitory residential center, that is it is a temporary shelter for the group of mentally ill patients who no longer need the full range of services of the hospital, but they are not yet ready for completely independent living or individual living in the community. So they have to give help, they have to support to develop and strengthen their individual capacities to go back to the community and follow the normal functioning or normal life. The objectives of halfway home or foster home is to ensure smooth transition from the hospital to the family. So they were taken treatment for a long period in the mental hospitals, and they have to go back and join with the family. They have to continue their services with the family, and they may have an adjustment problem with the families. For that, for a short period during the rehabilitation program, they will be given a separate transitory residential facilities. Next objective is to integrate the individual into mainstream of life. So bringing back to the individual to the normal mainstream of their regular life. For that, they have to make some adjustment, that is called as to integrate the individual into the mainstream of life. So these are the two objectives for halfway homes or foster home. Then activities include monitor the progress of the discharged patients or those who are staying in the transitory residential center or foster home regarding the continuation of the medication regimen or follow-up of the medication regimen. Usually mental ill patients with mental diseases may not take a continuous course of the treatment, so they need some guidance and support to complete their medications, and for that they need some support and some help or assistance and that called the smooth transition from the hospital to the family, or to make them to adjust with the from the hospital situation to family situations. Another activity is the coordination of the other facilities and services what is available for the patient, and make the patient utilize the available services and facilities. So this is about the halfway home or foster home. So it is a transitory or temporary residential center for a group of people, those who are already discharged from the hospitals, but they need some support. They need some helps to develop and strengthen their individual capacity to adjust to the or go back to the normal life after the prolonged hospital admission and treatment for the mental illness or diseases. The next one is self-help groups. The fifth community facility for the mentally ill people are forming various self-help groups. So self-help group are composed of a group of people who are trying to cope with a particular mental ill problems, that is specific problems or life in crisis, and their emotional health is already been improved and their well-being also improved like normal people. Then setting up of the self-help group in psychiatry is follow one principle, that is those who have experienced a particular problem are able to help others with the same problem. So like that, a group of people with a specific problem, they stay together. That is comes under self-help groups. So the principle of self-help group is those who have experienced a particular problem are able to help other peoples with the same problem, because they have already an experience about an exposure about the particular treatment of a specific problems. So they can guide, they can give advice, and they can share their feelings to the other people, those who are having the same problem. This is the principle behind the formation of self-help group. Then that means they emphasize, so this self-help group emphasize a cohesion, a group activities. They live as a specific group, and they have a strong emotional bond with the people with the same problems. That is, among the members, they have a strong bond because they all suffering with a particular problems. Thus, the members are homogeneity and they work together using their strength to gain the control over their lives. So, they work individually using their strength to gain control over their lives. That means they develop their that capacities, potentialities and strength to control over their life. And of course, they educate and support each other because they have a specific problem that will help to solving the problems of the particular group. Then they share their both good and bad experience in relation to the treatment and management of the particular problem, and their experience and exposure to the particular problems. Then there are some strategies for the self-help group. So the strategies used by the group leader of the self-help group is promotion of dialogue among the people in the group, then self-disclosure of their problems, then encouragement or support among the members in the group. Then they follow certain concept. The concept used under self-group is psychoeducation, self-disclosure and mutual support among the group people. So this is about the self-group. The last facility is other facilities, which includes a suicide prevention center, helping hands, and there are many voluntary and other the non-governmental agency to support the mentally ill people in the community settings. So these are the various facilities available in the community for the mentally ill people or people with different mental disorders. Next is issues in community mental health services or problems in community mental health nursing. Issues and problems in community mental health services and community mental health nursing. First one is limited manpower or lack of health worker or health personnel to render the community mental health nursing services. So inadequate health personnel to render the community mental health nursing services. Then uneven distribution of the resources. The facilities are varies from urban and rural area and varies between states to state in our country. That is uneven distribution of the resources such as man, money, material to render the effective community mental health nursing services. Third one is low priority in national budget. So when the government makes a national budget, government is giving less importance in having budget in relation to community mental health nursing services. So low priority or less importance in national budget to have money to render the to budget to render the various community mental health nursing services. Then GPs are not comfortable to manage the various mental illness and diseases. So GPs is nothing but general practitioners in India. They are not comfortable. They are not familiar to, or they feel difficulty to treat the mentally ill patients or patient with the different mental disorders in the general hospitals. Then lack of awareness in the community regarding the mental illness and various mental diseases and facilities available in the community, and moreover still there is a stigma and misconception regarding mental illness in the different states of the country. Then poor access to healthcare, especially in the rural area. There are less facilities and less access to the community people to avail the community mental health nursing services. Then seventh one is poor availability of the medications in relation to psychiatric diseases. So less availability or poor availability or lack of medications to treat the mental illness and mental disorders. Then eighth one is traditional healing techniques. There are many traditional practices, it is community based practices in treating the mental illness. Still it is going on, especially in the northern states. So people will follow some traditional or witchcraft activities or treatment techniques. That also is an important issue or problem in treating well, giving effective treatment with the indigenous system of medicines and other allopathy system of medicine to treat the mentally ill patient and thus to prevent and reduce the mental illness and mental diseases in our country. Then poverty. Of course, most of the mentally ill patients and their families are under, they struggle poverty after taking a treatment. So they may not continue the effective treatment or further treatment in the psychiatric specialty hospitals. That is regarding poverty also is an issues and problems in rendering effective community mental health nursing services to the community or people in the community. The last one is others. There are many other issues and problems in relation to render effective community mental health nursing services in India. For example, lack of community participation in rendering the community mental health nursing services. Then keeping secrecy about the mental illness or mental disorders in the family. They are not ready to disclose or share that problem with the medical team or community mental health nursing team, etc. So these are some of the other issues and problems in relation to community mental health nursing services. Next is community mental health programs. There are two important community mental health programs introduced by Government of India. First is in 1982, that is National Mental Health Program. National Mental Health Program. So Government of India launched National Mental Health Program in 1982. The important component of this National Mental Health Program is TPR, that is Treatment, Prevention and Rehabilitation. So, Treatment, Prevention and Rehabilitation Services. Then second is District Mental Health Program, that is DMHP. So in 1996, Government of India introduced the other program that is called District Mental Health Programs. The last one is various other mental health programs in the country, like for example crash programs that is given by the NIMHANS Bangalore, which includes a primary health center based rural mental health program, general practitioners based urban mental health program, and school mental health programs, etc. Thus there are many crash programs for the mentally ill patients and to treat the mental diseases at NIMHANS, that is one of the famous psychiatric hospitals in Bangalore. So they provide various crash programs to the mentally ill patients. So these are the three important community mental health programs in India. The next is role and functions of a community health nurse in community mental health nursing services or program. Role and functions of a community health nurse in community mental health nursing. So there are many roles a community health nurse can play in community mental health nursing, such as health monitor and promoter role. So she monitor the mental health of the people in the community. So that is promoter, that is promotion of the mental health of the people in the community. Then preventer role, that is preventive role, to prevent the mental illness and mental diseases in the community. Then providing direct care, basic care or domiciliary care to the community people. So care provider, manager, planner, organizer and coordinator of various community facilities and community program for the mentally ill patients. Then facilitator. There are many facilities in the community for the community people. So make the people to aware about such facilities and utilize maximum those facilities to reduce the problems. Then act as a supervisor, supervise the health personnels. Then training for the multi-purpose health workers and other health workers to render the community mental health nursing services. Then evaluator, health educator, that is to provide the mental health education to the community people. Counselor, to involve the counseling for the patients and families. And researchers, conduct various researches in community mental health nursing. Then motivate the people to reduce the consumption of alcohol, substance abuse, etc. Thus prevent the substance induced mental illness and mental disorders. Then domiciliary care, that is home care. So care of the patients and the families in the community settings during home visiting. Then act as a clinicians in the health center. Then act as a consultant to give the information to the mental ill patients and their families. Act as a therapist. So she then involvement of or assist in psychotherapy and cognitive therapy for the mentally ill patients. Act as a liaison. Liaison is the link, connect the mentally ill patient to the primary health center and to the medical officer to get the adequate services, or refer the patient during the home visiting, those who required further treatment and healthcare services. And act as an advocate to talk to the patients and manage the problem of the patients and give the right direction to the community people to get the adequate and effective mental health services. Then problem solver. So of course the community health nurse act as a problem solver, because the patient with a particular family in the community may have many issues because of their mental illness and diseases among the family members or with the society. In such cases, a community health nurse act as a problem solver. Then change agent. She changed the attitudes, changed the behavior of the community people, and she changed the stigma and other misconception about the mental illness and mental diseases among the community people. So she acts as a change agent. And last one is, there are many other roles a community health nurse can perform in the community to render the community mental health nursing programs or community mental health nursing services. So these are the important roles of the community health nurse in community mental health nursing. Then functions of a community health nurse in community mental health nursing. There are 6 important functions a community health nurse has to carry out during community mental health nursing services. That is, first one is to render the direct basic care, that is domiciliary care. So care to the mentally ill patient or his family in the community settings during home visiting. That is domiciliary care or basic care or direct care to the mentally ill patient. Second is mental health education. So awareness program, IEC programs. That is the mental health education. Provide mental health education to the community people and mental patients and his families. Then third one is conduct and assist in therapies, various therapies for the mentally ill patients and patient with mental diseases in the community setting, that is cognitive therapies, psychotherapies, etc. So conduct therapies and assist in therapies. Then fourth function is training. That is training the both the professional and non-professional health personnel in the community settings to render the community mental health nursing services. Then fifth function is supervision. So supervision of the multi-purpose health workers to render the domiciliary care to the mentally ill patients and patients with the mental diseases and his families in the community health setting during community mental health nursing services. So that is supervision. Then sixth function is research. That is conduct various researches, various topics related to community mental health nursing researches, and also assist the psychiatrists to conduct the various research, mental health researches in relation to community mental health nursing and mental health services. So these are the important 6 functions of a community health nurse, that is domiciliary care, mental health education, conduct therapies, cognitive and psychotherapies, training for the professional and the non-professional health workers to render the community mental health nursing, supervision of the multi-purpose health worker during home visiting to render the care to the mentally ill patients and his family in community mental health nursing, and research, conduct and assist the research program and conduct the research programs in community mental health nursing. There are many other functions. Some of the important or specific functions are, that is, first one is social skill training. So provide social skill training for the patients to adjust with the society and to go back to the society and start the normal life process and working to live in the society. So that is social skill training. Then anxiety management and relaxation technique for the psychiatric patients and his families, anxiety management and relaxation technique, and assertive training or vocational training for the people after discharge, mentally ill patients after discharge to continue with their normal functioning. That is assertive training, that is active training. And bereavement counseling for the families, those who are suffering from mentally ill patients or mental retarded patients or children in the family. So bereavement counseling, or those who are under mental crisis intervention, those families all should give on bereavement counseling. Then group meeting, that is conduct periodically group meeting with the families of the specific problems of mental illness in the community settings. Then render various community outreach work services or facilities. So there are many facilities that has to be provided to the community people under community mental health nursing services. Then conduct school health services or child care services for the modification of the behavioral and thus prevent the future occurrence of the mental illness and mental diseases in the community. The last one is adult care services and elderly services in the community as a part of the community mental health nursing services to prevent the mental illness and mental diseases to the adult and elderly people in the community. So these are some of the other specific functions of the community health nursing, community mental health nursing. So far we have discussed about the community mental health nursing in detail and in depth. Hope this video really benefits in your studies and exams. So if you feel it is really worth and benefit this video, please like, share and subscribe my channel, and stay tuned with the Angel Health Academy for the next academic or educational video. Thank you.